Hello, my name's Richard Walker, the Happiness Doctor. I use mind techniques like NLP and hypnosis. I want to talk to you today about chronic pain. Oh, by the way, my cat's decided to listen into this today, so forgive me if she, or rather he, excuse me, pipes up with the odd meow or complaint. But you can't always tell a cat what to do. I'm particularly going to talk about John Sarno's work, a medical doctor, and this book, Mind Body Prescription, is one that I'm going to refer to, and also this one, Healing Back Pain. What Sarno discovered, and he was an orthopedic surgeon, having worked many years and done surgery with people with back problems, he found when he came to retire that to a person, no one had benefited long term from the work he'd done, and to his credit, that got him thinking. Now, to cut a long story short, he started looking into the structure of chronic pain, and chronic pain is pain that's older than, say, 6 to 8 weeks. It's not the same as acute pain. Acute pain, and I'm not a medical guy, by the way, but acute pain is when something is damaged. Let's say something is wrong, and chronic pain is when basically it's past the period when the damage is really the cause of the pain. There's something else going on. Essentially, you could say it's emotional pain, and this is what Sarno is saying. It's kind of like a tension in the muscles. And Sarno talks about this applying to so many forms of pain. Certainly neck, shoulders, back, limb pain of various kinds, and even mentions fibromyalgia. I only happen to just notice that now. I haven't followed that part up, and I will do. But I'd just like to share with you a simple application and a powerful application of his approach, which came from modelling what he was doing. So Sarno has his own approach, but a guy that trained me, Dr. Chad James, and he's a trainer in neuro-linguistic programming, one of the original guys who worked with Bandler, probably the biggest training company in the world, I guess. Tad has a lot of experience, and he modelled what Sarno was doing. Now, I've used this technique, and Tad says spread the word, just tell people about it, get them using it. And when he told me this back in about 2005, he told me he'd been experimenting with it and hadn't found yet a case where it didn't work. And I must have used it in about, I don't know how many opportunities have I had to work with this, maybe under 20. Chronic pain isn't something that turns up regularly in a hypnotherapist's consulting room, as you might imagine. But as yet, I've never known it not work. And that's not bad going. Now, I'm not saying it's foolproof, but I've never known it not work. But here's the other thing. You need to be careful who you're using this with. And that's not that it's a danger, but, you know, just because someone's desperate for change doesn't really mean they're ready to do what it takes. You know, we're talking about brief therapy here and taking ultimate responsibility for your health and well-being, and that's not an easy place to go to. It is in theory, but in practice it's not as straightforward as you might imagine. So this isn't for everybody, but if you're willing to do this and find out what happens, you'd be surprised. Very simple. Okay. Now, this won't work for you, obviously, if you don't have a chronic pain. Remember, it's older than 6 to 8 weeks, not something that's hurting now because you've broken it, damaged it, picked up a paving slap over the weekend and twisted your back again. That's back to the acute phase, isn't it? This is pain that should have settled down long ago. And the doctors are saying, look, there's nothing we can actually physically find wrong now. You know, they've diagnosed chronic pain. You need to be experiencing that pain now in order to use this technique, because it's a real-time thing. Okay, it's a real thing we're going to do. Are you ready? So if this is you, first of all, what you want to do is to track how bad the pain is before we start. So on a scale 0 to 10, where 10 is the worst you can imagine and 0 is no sensation at all, just give it a subjective number, a number between 1 and 10. Okay, I don't know what number you've chosen. Now, are you ready to do this? Okay, this is about emotions. I need to ask you, What emotions are you feeling right now? What emotion are you feeling right now? Now I'm looking for a raw emotion. If you say, oh, I'm cheesed off with this pain, or it's really getting me down, then I'm going to ask you, how does that make you feel? Or, how do you feel about that? You might say cheesed off, or peed off, or now if you say angry, that's good, because now we're getting to a raw emotion. I'm looking for anger, sadness, fear, hurt, guilt, you know, what I call the primary colours of emotion, the raw feelings. That's what we're after. And if you don't get one, ask, how do I feel about that? And then ask, how do I feel about that? Until you get to a feeling that you can identify with. So ask yourself, what are you feeling right now? Now you may have to go deep inside for some of us and stop and just scan inside your body. How do you actually feel? Not in your head. A feeling is in your body, not in your head. That's a thought. Feelings inside the body. Okay? Oh, I feel annoyed. No, that's not good enough. How do you feel about that? Or how does that make you feel? Or what else do you feel? Get to a raw emotion. As soon as you get something like upset, well, even upset, well, how do you feel about that? How does that make you feel? What do you mean upset? When you think about being upset, how do you feel? I feel really sad. Upset may do it, but it sounds like a thought, not a feeling. If it's a feeling, the minute you notice the feeling, notice what happens to the pain. Go back inside and check what happened to the pain rating on the scale 0 to 10. What changes can you notice? Now if it drops 1 or 2, fine. Then ask yourself, what else am I feeling right now? What other emotions am I feeling right now? Okay, what other emotions am I feeling right now? What else am I feeling right now? Sad, angry, guilty, frightened. Frightened, okay, frightened's good. Fear. Then this may help, just to help you get in touch with the feeling, is actually say it out loud. I feel frightened. Or I feel angry. I'm angry. I'm upset. Whatever that feeling is, because it's about getting in touch with the emotions, just say it out loud, and be aware of that feeling. Notice what happens to the pain rating. You'll find it drops. Now you can keep going round with this, asking yourself, what else do I feel? Getting to a raw emotion until that pain gets down to, you can get it down to 0. If it's chronic pain, you can get it down to 0. What Sarno says is happening is that emotion is like a kind of a tension in a muscle, and a muscle, when it tightens, can kind of tighten around a blood vessel, and that's like oxygen starvation, and oxygen starvation is the kind of structure of pain. Does that make sense? Like angina is starvation of oxygen to the heart muscle. That kind of idea. Now here's the thing. If you're trying to get rid of pain, and if Sarno's right, and you're trying to get rid of pain by some other means, in other words, not listening to your emotions, and your body is trying to bring these feelings to your attention because you're not dealing with them, what Tad James says, is that if you do that, and as Sarno hints at the same thing, in fact he says the same thing in the front of a couple of these books, both of these, that the pain will come back with a vengeance. In other words, it will get worse because you're trying to take a message away that your body is trying to give you, and you're ignoring it. So it just cranks up the message, like a child that's not being paid attention to. It just shouts louder. Pain is a message from your body saying something needs attending to. And if it's not a physical thing, if it's not acute pain, then it's emotional issues. We're not paying attention to our emotions, our feelings. You may have good reason not to pay attention to your feelings, and you may possibly have done that for a very long time, because we're all different. But this is the consequence. Get used to paying attention to your emotions for at least a week, 7 full days, noticing the pain dropping, before you use any method for getting rid of those negative emotions or taking the pain away. And there are lots of techniques. I have my own techniques for resolving those negative emotions, of course, but whatever method you use, that's the risk you take if you don't get used to paying attention to the emotions. Let me know how you get on with it. I'd like to hear. Happy to talk with you by email if you'd like to explore this further. Have a good day. Richard Walker, the Happiness Doctor.